my year of practice, I've met varieties of patients. I'll say I have the funny one, we'll talk about them later. And why I have the stubborn one, these are the ones that will not come for follow-up, they are the ones that will not comply to medication, they are the ones that you will take your time to counsel over and over again, despite that they will still go ahead to do what is on their mind. And I have the obedient one, in that every tiny bit of advice given to them, they ensure that they take it very seriously. And these ones will have little or no challenge over their management. Okay, now, so to the funny one now, these are the ones that will come into the consulting room. I'll be like, doctor, I've been sick for quite a few days now, and I think it's injection that is going to cure me. While others will come and be like, see, my home malaria does not respond to oral medication. Unless you give me injection, I can never be well. And I'll be like, wow, where do you guys get all of this notion from? And so in this part of the world, some people actually believe so much in injection that if their doctor does not prescribe it for them, it's as if their doctor is not competent enough. And so many times when I come across this kind of patient, I usually take my time to explain to them why it may be better for them to have oral medication instead of injection. Of course, some do take the advice while others try to sort out themselves in other facilities. So welcome back to my YouTube channel, and in today's episode I'll be sharing with you why oral medication might be the best for you instead of injection. However, if injection is actually necessary for your illness, trust me, your doctor will not hesitate to give you such. So number one reason why oral medication is better than injection is that with injection, needle is involved. With needle, there is risk of transmission of blood-borne diseases such as HIV, hepatitis. So many people have contracted this disease not because they were promiscuous, but because somebody was careless in making use of an infected needle. Also, with needle, there is risk of nerve damage, especially if it is an unskilled or inexperienced person that is giving the injection, who due to lack of competence missed out on the safe zone to give the injection. So with injection, the chances of getting microorganism into the body is also very high. In 2022, during my internship, we had a patient, a pediatric patient, about 8 or 9 years old, who was sick, and the mother took her to the chemist shop where she was given injection. Few days after, she started having pain in the injection site, and then it started swelling up. They didn't present to the hospital on time. I think they presented about a month later when the swelling was so big. And when we saw these patients, we needed to cut open the swelling and were able to drain about 500 mils of pus. Patient also had other complication in which one of her legs was shorter than the other one. So please be careful out there. Be careful of who give you injection, what for whatsoever. And that is why if oral medication can do the job, why go for injection? So number two reason why oral medication is better than injection is that oral medication is convenient to use. I mean, you can be in your house and take your medication. You can be in church. You can take your medication to your place of work and you take it. But with injection, you have to be going to the health facility. You have to be going to the hospital much frequently. And with much exposure to hospitals, you are also predisposed to contacting infections. Apart from you being frequent at the hospital, you also need an assistant, maybe a relative or a caregiver, that will also have to follow you to the health facility, thereby inconveniencing them. Number three is that oral medication is cheaper than injection. I mean, in terms of the actual price of injection, they are quite more expensive than the oral form of the same medication. Apart from the injection itself, you also need things like glove, cannula, needle and syringe, and all of this come at an additional cost. The last but not the least is that with oral medication, there is no pain, absolutely no pain from needle or cannula, except for the bitter taste at times. So these are some of the things your doctor consider before deciding that it is best to have oral medication instead of injection. As I have said earlier, if your illness warrants that you take injection, your doctor will not hesitate to give you such. I hope this video has been helpful. Thanks for staying to the end of this video. Please kindly subscribe, comment, like, and share, and I'll see you in my next video. Bye.